Okay, so I'll be palpating the gracilis. The origin is the pubic symphysis and the inferior pubic ramus, and it inserts down here at the pons serene, and you can palpate up in here and all the way down to here. And its action is hip adduction, knee flexion, and internal rotation. So this is the adductor magnus. The origin is at the pubic ramus and the ischial tuberosity, which is back in here, and the insertion is adductor tubercle right in here, and you can palpate it throughout here. It does hip adduction and internal rotation. Is the adductor longus. It attaches to the pubic symphysis, which you cannot palpate. It inserts at the linea aspera, which is on the back of the leg, and it does hip adduction and internal rotation. So this is the adductor brevis. It attaches at the pubic symphysis and inserts at the linea aspera. It does hip adduction and internal rotation. Yeah, the next one's the pectineus. You cannot palpate it because of where it's located, but it attaches at the anterior pubis and inserts at the pectineal line of the femur, and it does hip adduction. Okay, so this is sartorius. It attaches at the anterior superior iliac spine, and it goes all the way down. The muscle belly is in here, and then it attaches down here at the pons serene. It does knee flexion, internal rotation, hip flexion, hip abduction, and hip external rotation. So this is the rectus femoris. It attaches the AIIS, and it goes all the way down the leg over the patella and attaches on the tibia tuberosity. It does knee extension and hip flexion. So this is tensor fasciae lata, or TFL. It attaches up on the iliac crest and the ASIS, and it goes down all the way to Gerdy's tubercle and the head of the fibula via IT band, and it does hip abduction, flexion, and internal rotation. This is iliopsoas, so the origin is the iliac crest up here and the fossa. The transverse process of T12 to L5, which you cannot palpate. Then it inserts in the lesser trochanter of the femur, which is on the back of the leg, which is not palpable, and it does hip flexion. So this is the glute max. It attaches at the posterior sacrum, the ilium, and the superior gluteal line, and it goes all the way down here into the gluteal tuberosity, which is you find the greater trochanter, and you kind of go behind it, and it also attaches onto the IT band. It does hip extension, external rotation, abduction. So this is glute min. It attaches on the posterior ilium between the inferior and medial gluteal lines. Inserts on the anterior portion of the greater trochanter. It does hip abduction, flexion, and internal rotation. So this is glute med. It attaches on the iliac crest right in here, and it goes down and inserts on the lateral greater trochanter. It does hip abduction, extension, lateral and internal rotation. So this is semimembranosus. It attaches at the ischial tuberosity, and it goes down to the posterior medial portion of the tibia and the medial condyle. It does knee flexion, internal tibial rotation, hip extension, and hip internal rotation. This is semitendinosus. Attaches at the ischial tuberosity, and it goes down and around to pons serene. It does knee flexion, hip internal rotation, hip extension, and hip internal rotation. This is the biceps femoris. The long head is the only thing you can palpate, and it's attaches at the ischial tuberosity, and it goes down to the lateral fibular head and the lateral tibial condyle. It does knee flexion, external tibial rotation. The long head is hip extension and external rotation. So this is manual muscle test for the adductors. You'll have the person side lying on the side you are testing them on. You will have them flex their knee like this and their hip. You'll have them lift their leg up off the table. You'll support at the hip and then push down on the leg for 5 seconds. So hold for 5 seconds. Okay. 1, 2, 3, 4, 5, and relax. This is a manual muscle test for the hip internal rotators. You'll have your patient in short sitting, and you will have them take their leg out, and then you'll tell them to hold a position for 5 seconds. Okay, ready, hold. 1, 2, 3, 4, 5. Now for the external rotators, you'll have them bring their leg in, and once again, hold a position for 5 seconds. Ready, hold. 1, 2, 3, 4, 5, and relax. So this is the manual muscle test for the hip flexors. The patient will be in short sitting. You will have them lift their leg up off the table, make sure they're sitting right, and you will push down on their leg for 5 seconds. So ready, hold. 1, 2, 3, 4, 5, and relax. This is a manual muscle test for the TFL. Your patient will be lying supine, and you will have them lift their leg up off the table and internally rotate, and you will support up at the hip and push down on their leg. So hold for 5 seconds. Ready, hold. 1, 2, 3, 4, 5, and relax. This is a manual muscle test for iliopsoas. You'll have your patient lying supine and lift their leg up off the table and externally rotate. You'll support at the hip and then push down. And you'll tell them to hold 5 seconds. So hold. 1, 2, 3, 4, 5, and relax. This is the manual muscle test for glute min. You'll have your patient lying on their side and make sure their shoulders, hips, knees, and feet are in line with each other. You'll have them lift their leg up, and then you will push down. You'll support the hip and make sure they will roll back when you do this, and then push down. So hold for 5 seconds. Okay, ready, hold. 1, 2, 3, 4, 5, and relax. So this is the manual muscle test for glute med. You'll have your person lying on their side with shoulders, hips, knees, and feet in line with each other. You'll have them lift their leg up, abduct slightly, and then out, externally rotate, and then you will push and make them hold for 5 seconds. So ready, hold. 1, 2, 3, 4, 5, and relax. Okay, this is a manual muscle test for glute max. You'll have your patient lying prone. You'll get them to bring their knee to 90 degrees, lift their thigh off the table, and you'll make sure that their knees are parallel and their hips don't rotate. You'll support on the back, and then you'll push down on their leg. So hold for 5 seconds. Okay, hold. 1, 2, 3, 4, 5, and relax.